So my name is Laurel Redding. I am an assistant professor of epidemiology at the University of Pennsylvania School of Veterinary Medicine, and I have a great interest in antimicrobial use in general in veterinary medicine and ways that we as veterinarians can improve and promote the judicious use of antimicrobials. We all know that antimicrobial resistance is a increasingly big problem, and there's a general consensus that in terms of human health, I guess the biggest contributor to the rise of antimicrobial resistance is antimicrobial use in human medicine. But antimicrobials are used a lot in veterinary medicine as well. And we owe it to our patients and to the general public health community to try and use antimicrobials in the most judicious manner possible. Now, as private practice veterinarians and small animal, companion animal veterinarians, that can be a tall order because we have a lot of things going on. We have busy schedules, we have short appointment times, we have owners making decisions for a lot of things based on cost, and that can limit what we can do as practitioners. And so sometimes it becomes very difficult to think about the issue of antimicrobial resistance. It's kind of this nebulous, abstract issue when you've got a patient right there in front of you. But I think that there are certainly things that we can do to integrate antimicrobial stewardship into our daily practices. And of course, the immediate health of the pet is everyone's highest priority. And we get it that it can be overwhelming to even think about a nebulous, abstract issue like antimicrobial resistance when you've got 15 minutes for appointment and you're already running late. For pet owners, I would remind them that they really do have an important role to play in promoting the judicious use of antimicrobials. A lot of the courses of antimicrobial therapy that we give in veterinary medicine are done on an outpatient basis, so at home. And so, pet owners are really at the forefront of making sure that antimicrobials are used judiciously. So, when your vet prescribes you an antibiotic, always administer it as directed. And if your vet says they need to see your pet before they can prescribe an antibiotic, it's for a good reason. And so, the classic case we see is, an animal with a chronic ear infection. And a lot of times, owners just kind of want a refill of what they got the last time because it worked the last time. And sometimes that works, but overall, that's not setting yourself up for success in terms of treatment for your pet because they can have resistant infections. They can have a different type of infection. So if a vet says, come in, we need to get a swab of the dog's ear before we can prescribe something else, it's for a reason. They're trying to get the best outcome for your pet. If your vet says your pet doesn't need antimicrobials, even though your pet may seem sick to you, certainly ask your vet why. Ask your vet what is guiding that thinking. But also remember that your vet does always have your pet's health and well-being forefront in their mind, and that your trust in your vet is well-placed and all desire to achieve the best outcome for your pet. If a vet is prescribing antimicrobials for a pet, it's based on what we know about the biology of the animal, the biology of the disease, and the way a drug interacts with the body of the pet. And so they're giving you a dosing schedule and a length of therapy that's really geared towards giving you the best outcome for your pet. And so it's quite important to follow the directions. Okay, if they say twice a day, the reason they're saying twice a day is because if you just give it once a day, it's not going to be achieving the levels in the blood that they're needed to distribute to the site of infection enough if you just do it once a day. So you really need to do it twice a day. If your vet says to treat for a week and your pet starts looking better after a day or two, you still need to finish that course of antimicrobial therapy. It's really important because just because an animal is feeling better and looking better doesn't mean that those bacteria that are causing the problem still aren't hiding out there and need to be treated for a longer duration. And in terms of cutting pills down to cut costs, there are ways to work with your vet to bring the cost down of medications. Oftentimes, you can take a script to a human pharmacy because a lot of the times the same drugs that are used in animals are used in people. And so, sometimes you can get a pill cheaper at a different source. But it is critical to really follow the directions that the vet gives you. There's a reason that people are worried about antimicrobial resistance. It is a threat to both human health and animal health. So a resistant infection, that infection can be harder to treat. And that can mean your animal is sick longer. It can mean that your animal may not be able to get better. And it might mean increased costs because, then you have to go for big gun measures. Like, if you have a wound with an antibiotic resistant infection, then you have to go for things like everyday bandage dressing, and usually means increased costs and increased suffering for your pet. Additionally, there is also the possibility that antimicrobial resistance pathogens or bacteria can be passed between animals and people, and that can result in illness for people, especially in people who are vulnerable, like young children, like the elderly, like people who have a compromised immune system, pregnant women, that sort of thing. There is that possibility of disease transmission between them. And so the more we can do to keep antimicrobial resistant pathogens from spreading and developing, the better it is for both animal and human health.